Dr. Surakshith, but very close friend of mine and my college mate. We've seen a lot together.
Yeah.
And today he's very successful, and he's a founder of Indigo Women's Center, and he's a fertility specialist, cosmetic gynecologist, and an amazing surgeon, laparoscopic surgeon. And we're glad to cover some wide range of topics and awareness for all our viewers on our channel at Atmed Healthcare. And thank you for supporting us on our channel.
Thank you so much, Suresh.
So we can
It's great
start
for me to have, it's great for you to have me here. Thank you so much.
Surakshith, I'd like to know about your journey in this field of reproductive medicine.
Yeah.
And also some of the challenges what you have faced. Like,
Yeah.
to start with, actually, being a male in the field, right?
Yeah.
You to get into this field.
Yeah.
Could you specify more on how you went through all of this?
So being a male in gynecology is definitely an upwards battle.
Yeah.
We have to cross a lot more barriers to, actually get our name out. I mean, for people to recognize you, it does take time. But I think thanks to social media nowadays, I'm able to give my philosophy of treatment, which some of the patients like.
Okay.
And they tend to come to us. So yes, definitely being a male in this field, you are going to have an upwards battle.
Okay. So how would you say you gave confidence to your patients? Like I've seen a lot of your content.
Yeah.
And it's good. It's very good.
Thank
Okay.
you.
So I want to know how you gave confidence to them before you got on social media.
So if a patient had to come to me and then she had to decide between two doctors, you're asking like, how would you say you're better, right?
Yeah.
I think most of the things what we do are skill based. So I would show them a couple of my surgeries.
Okay.
So that is what translated into Instagram right now, where I post my surgeries. People get to see, people get to critique them. And if they think, yes, this is the kind of surgeon I want dealing with my issue, they would come to me. So before we get started as well, I wanted to tell it to a lot of people out there as well. After seeing me, like many people were motivated to start going to gym and start working out.
Yeah.
So my motivation started with Suresh. When I saw this guy, so we were roll numbers 131, 132.
Yeah.
And then once I saw this guy and his fitness goals, I was like, man, I need to be like this. Before you remember, I was like really fat. I was close to around 110.
I went through that phase also.
Yeah, but when I saw you in college, you were fit.
Thanks.
And from that fitness, I really, drew a lot of inspiration from that. So people who ask me, right, I tell them, I have fitness inspiration as well.
Thank you so much. Now you're inspiring me on both.
Oh, yeah.
The professional and the fitness front. It's amazing.
Yeah.
I mean, because what you're doing, right, like it
Yeah.
actually helps in your field also.
Yep.
You would tell everyone to be healthy, reduce their weight, and
Yeah.
all of this actually helps in reproductive medicine, right? So you're set an example over there. Very
You
good
can't be a
benchmark.
fat guy asking people to lose weight, right?
Yeah.
It doesn't work that way.
You're right.
Yeah.
Right, yeah.
Yeah. And that's what happens nowadays, they ask patients to go on a diet.
Yeah.
They are obese themselves. It's not going to work. They're
I
like,
agree.
why should I listen to this guy?
I agree. And likewise, patients are also very, aware of all this.
Of course.
So they'll see how serious you are about your job also. So yeah.
They're hyper aware
Yeah.
because they have the same tools what we have.
Yeah.
Right? They have Google, they have even now Chat GPT, they have the access to AI. So they of course have sometimes more information than the doctor themselves.
That's true.
So
I wish we had it during our days.
yeah, absolutely. It would have been much more better.
Yeah.
Easier during exams.
So another amazing thing which I've read about you is you've had like over 10,000 surgeries, maybe more. Okay.
Yeah, now a lot more.
Yeah, now a lot more. So could you tell me one case out of the 10,000, so whatever, or more than that, which has stayed with you, which has been close to your heart?
Yeah, I think the one which has really hit me a lot is there was this patient who had recurrent miscarriages, right, in her second trimester. As in the baby keeps growing, but the problem is the cervix, which is the lower part of the uterus, is very loose. It's not able to hold the baby. So when the baby is alive itself, the whole pregnancy comes out.
Oh, okay.
And the only treatment which people used to do for this previously is try to put a stitch from below so that the baby doesn't come out.
Understood.
So for this patient, uh, we have decided to go on a different approach where through the abdomen, so putting a laparoscope through the abdomen, we were able to put a stitch much higher up.
Nice.
So that stitch had helped her getting a pregnancy after that. We delivered a baby at around 38 weeks and she named the baby after me.
Amazing.
So I think that definitely is one of my landmark
That's
things.
amazing.
Yeah.
Congratulations on that.
Thank you.
Yeah.
Thank you.
So, I mean, apart from being a fertility specialist,
Yeah.
right? I've seen you get on TEDx,
Yeah.
and you've also been into fitness, and you manage your podcast, and you manage your own, social media presence. How do you balance all of this in a day?
So I think early on I have decided that I want to make time for myself. So I have exactly known what I have to do for that. So I think if you remember from college itself, I think you and I we are pretty much on the same boat.
Yeah.
Like we never wanted to have too much responsibility. Of course, if you go into an institution, you are going to have that responsibility.
Yeah.
If you are going to go into a corporate unit, you are going to have that responsibility. As in the excess responsibility is what I'm
Yeah.
saying. The things which you don't have to do. But if you have your own unit, you dictate how much responsibility you want to take.
Yeah.
You can, dedicate work to others. So I'm very happy at a very earlier stage I decided on this, taken a big risk and got into it. And, right now I have time
Yeah.
to be able to spend for other things. So I think I'm happy about my, way of thinking because I was only in Apollo for 6 months.
Oh, only for 6
Only
months.
for 6 months. I
Okay.
was like, this is not the life I want.
Okay.
So I decided to move out of there and then start my own unit.
So, but I'd say in the initial days you had a lot of hard work, right? Like,
Yeah.
yeah, the initial days have been difficult, like
Yeah.
setting it up. I
It
mean,
was,
your
yeah.
your hospital,
Yeah, it was.
and then finally to come to this stage in your life where you can balance everything. How
Yeah.
long do you think that took?
Took a long time. I think when I first took the loan, I
Oh
mean,
my
I
God,
had no idea. Like
I can
you,
imagine the stress.
yeah, like there was the first time I was taking a loan and I had to take 3 loans to be able to build this hospital. And I didn't know whether it's going to do well or not. So there's a lot of risk I've taken. There's a lot of confidence you need to build up in yourself to be able to do something like that. So it was definitely challenging. The first, 1 year, we didn't see anything. So I was like, okay, what did I do? Have I done something wrong? Should I have listened to everybody? Like, should I have listened to my dad, my mom who said, don't do this? you know and then when things start happening, when you first get your first case and everything else, everything builds up from there. Yeah, so it was challenging. I think for me it would have taken around two years to be able to get to a place where I was able to do my daily activities without any concerns, as in run my daily hospital works with no issues. But I think after that, by the next year, it was completely different. We were able to break even by the next 1 year.
It's amazing. So, if you, I mean, the reason why I asked this question was because there'll be other people who are inspired by you. They want to do what you're doing
Yeah.
in whichever field it is, right?
Yeah.
So, they'd have to know the basis, like how long would it take, or to be in a settled state.
Yeah.
Because actually, you're never settled.
You're never settled.
You
Yeah,
have to
of course.
you have to keep
Of
moving
course,
up.
yeah, yeah.
So that's
Yeah.
pretty amazing.
Thank you.
Yeah.
I think when you're asking about what about for the others, right? I think it also depends a lot on luck.
Okay.
Luck also plays a factor, but if you need luck to work in your, if you need luck to work for you, you need to work hard for it.
Yeah.
So it's both together.
So I'd say, yeah, I think everybody gets lucky in some part of their life.
Yeah, yeah, yeah.
It's just that whether you're prepared enough or not to
Yeah.
utilize that opportunity.
Absolutely,
That's
yeah,
what
yeah.
That's what you're trying to say.
Absolutely, yeah.
Got it. So could you tell me your journey in starting Indigo Hospital?
Yeah.
Eppo armiching and the hospital, and was it like how you said your break even was 1 year, right, or 1 or 2 years?
After 2 years, I was able to run my daily, like for example, I didn't have to worry about paying from my bank.
True.
So it was starting to run by itself in 2 years.
In 2 years. Okay.
And after the 2 years, I had like a sudden boost where from the second year to third year, I was able to break even. So I was able to slowly pay back all my loans.
So, like, which year did you start your hospital?
2016.
2016 you
Yeah,
started your
I've
hospital.
started my hospital in
Okay.
2016, and we were trying to find out on ways to do how. See, because right now, when I first started out the hospital, the concept what I was putting out was not available anywhere. Now, a lot of these concepts have come up, where only centric on women,
Okay.
women centric nursing home with not more than 20 beds. Because what happens is if you have more than 20 beds in your
I agree on
hospital,
this. Yeah.
you need to worry about filling up those beds,
Yes.
right? And then you will have to unnecessarily put admissions for patients. That's how like
Yes.
corporates work,
Yes.
right?
Yes.
They will give a target to a doctor. You need
Yes.
to give us at least like 20 admissions this month. You need to do like 10 surgeries. When you give such targets, right, they are forced to do things which they would have not done otherwise.
Agreed.
So, I feel 20 beds is where
Ideal spot.
is the ideal spot.
Okay. So, and besides that, would you say, was it difficult for you to bring another team of doctors also to manage the hospital?
So, if you look at my unit, it doesn't have anybody else. It
Okay.
just has me and my wife. So, my
Okay.
wife does all the scans and I do the procedures. My dad takes care of the fertility part.
Yes.
And,
Okay.
and I have fellows who are working under me. So,
Okay.
they learn how to do surgeries from us. They learn
Right.
how to, do IVF procedures from us. So,
Amazing.
yeah,
Okay.
yeah.
So, Ipo, I want to ask you what is the common myth you'd want to debunk with
Yeah.
fertility? Like fertility வந்து you'd have seen நிறைய போஸ்ட் இருக்கும் இந்த மாதிரி
ஆமாம்
இந்த மருந்து சாப்பிட்டா இப்படி இருக்கும் அது
ஆமாம்
இது பண்ணக்கூடாது ஐவிஎஃப் பண்ணக்கூடாது
ஆமாம்
ஸோ
ஆமாம்
வாட் ஆர் த திங்ஸ் யூ வாண்ட் டு debunk in this what
ஸோ மேக்ஸிமம் நான் என்ன சொல்ல வரேன்னா உங்களுக்கு ஃபர்டிலிட்டி இஷ்யூஸ் இருக்குன்றது இட்ஸ் ஓவர் டயக்னோஸ்ட். ஏன்னா ஹைப்பர் அவேர்னஸ் சோஷியல் மீடியானால நம்மளுக்கு எல்லாமே ஒரு ஓவர் அவேர்னஸ் இருக்குது. ஸோ நம்மளுக்கு இஷ்யூ இல்லைன்னா கூட நம்மளுக்கு ஃபர்டிலிட்டி இஷ்யூஸ் இருக்குன்னு நம்ம வி ஆர் கீப் மேக்கிங் இன் அவர் ஓன் மைண்ட்ஸ். So this is the main reason why the influencers and everyone else are using this opportunity in the fear use பண்ணி they are selling products.
understood
So what I would like to say is get off social media, number one. I mean, at least don't look at these things.
yeah
Don't look at issues which are which you think you might have.
okay
Rather, just go to a doctor.
yeah
They will tell you whether you have an issue or not.
okay
Don't self-diagnose.
ஸோ இந்த செல்ஃப் டயக்னோசிஸில் வந்து எது வந்து ஒரு காமனான இஷ்யூவோட வந்திருப்பாங்க லைக் பட் அது ஒரு எப்படி சொல்கிறது இட் வுட் பி அ மித் இல்லை கம் அண்ட் ஆஸ்க் யூ அண்ட் ஸ்டாண்டர்ட் கொஸ்டின்
Yeah.
அண்ட் தேல் பி லைக் இப்படி பண்ணால் இப்படி ஆகிடுமா டாக்டர்
Yeah.
கேன் யூ கிவ் மீ an எக்ஸாம்பிள் ஃபார் தட் fertility
I think maximum mythன்னு பார்த்தீங்கன்னா PCOD.
ஓகே
பிசிஓடிக்கு வந்து நான் இந்த மாதிரி டயட் பண்ணேன், நான் வந்து ஃபுல்லாக லைஃப் ஸ்டைல் நல்லா இருந்துச்சு, என் டயட் நல்லா இருக்குது, ஆக்டிவ் லைஃப் ஸ்டைல் இருந்தது, ஏன் எனக்கு பிசிஓடி இருக்குது டாக்டர்ன்றது வருவாங்க. பட் பிசிஓடின்றது இட்ஸ் நாட் ஓன்லி அ லைஃப் ஸ்டைல் இஷ்யூ, இட்ஸ் ஆல்சோ ஜெனட்டிக் இஷ்யூ.
ஜெனட்டிக் ஆல்சோ
Absolutely. ஸோ அதனால நீங்கள் பார்த்தீங்கன்னா இட்ஸ் அ மெட்டபாலிக் இஷ்யூ, இட்ஸ் அ ஜெனட்டிக் இஷ்யூ, இட்ஸ் அ லாட் ஆஃப் இஷ்யூஸ் கம்பைன்ட் இன்டு ஒன். ஸோ இது மட்டும் பண்ணால் இது சரியாகுன்றது there is no such thing. So that's why many people unfortunately they'll waste a lot of time trying to get their lifestyle in check before they go for pregnancy. And by the time they go for pregnancy enna aguna it's too late. They'll become 31, 32 and it becomes more challenging for us to help them conceive. But yes, lifestyle is important. But இப்போ உங்களுக்கு pregnancy important na நீங்க ரெண்டுமே you have to do it together
and at the right time.
at the right time.
ஓகே ஸோ ஒரு கரெக்டான கைடன்ஸ்க்கு போகணும்.
Guidance,
டாக்டர் he has to go to the proper doctor and okay it's not wrong for them to ask the questions actually.
Absolutely,
They can get it out of the system but they should not be diving into that too much.
Yes, never self-diagnosis and they should stop doing that.
Okay, got it. I mean, another thing I'm very proud of, like for you to studied with you, and you've been getting so many accolades. Like, then I think you got some,
The icon
prize icon award.
Yeah.
And what did that mean to you? And were you surprised that you got it, or how was it?
I think the most surprised I was when I got on the TED stage. I didn't expect to
That's
be
something.
there.
Yeah.
These awards, I think, it means something, it might not mean something. But I think the most surprising thing is for, people do recognize what you're doing. I did realize at that point of time that, from somewhere, someone are actually watching you. So make sure whatever you do,
Showcase it.
showcase it.
Got it.
Let people understand what you're doing.
Agreed. And so, how was it when you got on TED,
Yeah,
like TEDx,
yeah,
right?
yeah.
Was it how did you feel nervous? Were you thinking, okay, what am I going to,
Yeah.
how am I going to take this forward, or
Yes.
how am I going to talk over
It's a
there
very different experience. I think
Yeah.
you'll have to be there to
to
really
understand
understand, like,
it?
the kind of, pressure you will have.
Yeah.
I never felt that pressure after exams, in college. The last time I had to feel pressure was in our final year exams.
Yeah.
PG exam also was okay. And the next was only the TED stage,
TED
So,
stage.
yeah. Never prepared for anything more than that.
Okay.
And still you mess up. Yeah, yeah.
About Indigo, Women's Center.
Yeah, yeah.
I want to know what are your future plans from here, because you've understood the concept.
Yeah.
ஒரு ஹாஸ்பிட்டல் ரன் பண்ணால் ஒரு 20 பெட்ஸ் 20 பெட் வந்து இஸ் அ சக்ஸஸ்ஃபுல் மாடல்.
Ama, yeah.
And you can actually work on quality also,
Yeah.
besides the quantity.
Yeah.
And okay, you've set a standard, you're mastered IVF, and you know fertility is a thing, but there must be a lot of emerging trends. And what's your future for the hospital?
I think நீங்க சொன்ன மாதிரி the future is of course AI,
Okay.
and how number one we can integrate AI into fertility practices,
How would you do that?
because AI will guide us எப்படி நம்ம டோசேஜ் பண்ணோம், டோசேஜ் எவ்வளோ போடலாம், எப்போ நம்ம வந்து எக்கு வெளியே எடுக்கலாம், எப்போ வந்து இக்ஸி பண்ணலாம், எப்போ நம்ம வந்து ட்ரான்ஸ்ஃபர் பண்ணலாம். ஸோ ஏஐ நம்ம வந்து யூஸிங் ஆல் த டேட்டா இட் ஹேஸ் ஆல் ஓவர் த வேர்ல்ட்,
Okay.
it will compress it and it will give us individualized treatments
Okay.
for patients. So this is the future.
Amazing.
And definitely I think I think it is going to get into all fields of medicine, not just infertility.
Okay.
But for infertility they are currently working on it as well.
This is a good eye opener. It's something I have to think about
Yeah,
also.
yeah. AI நீங்க பாத்தீங்கன்னா it is the future. I mean it is already there, and definitely it is also coming into medical field in a big way.
Oh, okay.
In fact, even for surgeries, இப்போ நீங்கள் surgery பார்த்தீங்கன்னா, if by chance the surgeon is doing, if you're doing a robotic surgery, if the surgeon is doing, is about to do a mistake, the AI will give a prompt. Maybe this is not what you want to, maybe you want to do this.
Are you serious? Yeah?
So, yeah.
Oh my.
Yeah.
Okay.
So, AI is really coming up.
So I had another doubt. Like I've been, there's a lot of debate on this.
Yeah.
I have senior surgeons. I've
Yeah.
talked to senior surgeons and good surgeons. They were good surgeons like you. And what they say, some of them don't believe in robotic surgery too much.
Yeah.
Okay, so I just wanted to understand this. Like they feel that it's still in a nascent stage. I won't say it's not good. Okay,
Yeah.
but it's in a nascent stage, and they prefer to use their hand fully in comparison to robotic surgery. What is your take on that?
It's just like how we have any medical innovation, right?
Okay.
இப்போ நீங்கள் பார்த்தீங்கன்னா when it was open surgery, nobody wanted to do laparoscopic surgery. They said it is going against the clock. Open surgery is it's like worse than laparoscopic surgery is worse than open surgery.
They used to say that, right?
Of course.
Okay.
Of course.
Okay.
My own professors used to be like, oh, if you do laparoscopy, it's only useful for diagnosis, not for treatment.
Okay.
Now look at us today. Everything we do
Everything we're
laparoscopy.
doing it, yeah.
It's just like that. Now everyone is doing laparoscopy. They are saying this about robotic. Of course, robotic is the future.
Okay, it's the future.
That's inevitable.
Okay. And could you tell me more about your 3D laparoscopy? I think I was watching you on your social media also. And I was certain, you're going to go for this because from college days, you've actually been a tech guy.
I am a tech guy.
And you should not underestimate guys who are really good in video games and a lot of other stuff like that, because actually they'll ace in surgery later on. Okay. So
I think the thing about, I'll tell you how I got into surgery in the first place. I was working in Apollo.
Okay.
Isn't it? I had no idea what laparoscopic surgery was before that, because in college we never thought about laparoscopy. It was all only open surgery.
Open, yeah.
So I went there. I saw this guy operating on surgery. Like, I know this is called as hand-eye coordination because this is what we do for gaming all the time.
Exactly.
So we look at the TV and we put our inputs over here. I was looking at this guy and he was struggling. I said, I thought I can do better than this guy.
I thought, see, I told you.
So so that clicked and I started training in that. So that's how I got into things. So of course 3D is the latest innovation, and because we are probably one of the few centers in the whole of Tamil Nadu who has this 3D technology, because we do only these procedures. There are things which our two-dimensional vision will not help in surgeries.
Okay.
But you need the depth. And the
Okay.
depth one the 3D gives us, and that is what we
Okay.
use in our operating system as well. So
you're
we use
actively
the
using-
glasses and we do the procedures.
Amazing.
3D glasses.
That's good.
Yeah.
So when a patient comes to you in Indigo, right, in your hospital,
Yeah.
what are the steps you ensure? Like you must be having a certain protocol.
Yes.
For them to have a very comfortable and good experience. Could you elaborate on that?
Yeah, I think it starts right from the entrance into the hospital.
Yes.
Make it convenient for them. I think, you're having a person to help with the parking, having a valet. The moment they are inside, someone greets them, makes them feel at ease. Especially in our field, they come with so much anxiety.
Agreed. Yeah.
You don't want to increase the amount of anxiety what they have. Make them relaxed, give them nice, comfortable. Don't give those airport chairs. 90% of places have those airport. I mean, these are all humans, right? Like they are people. You want to treat them with respect.
Yeah.
So you give that respect. They obviously know this is their MO. They understand your philosophy, and I think that is very important. Care is something we need to give for our patients, and I think ultimately, if you give that care, they are going to come back to you.
I agreed with that.
Yeah.
And you have planned surgeries, a lot of planned surgeries. I know it's almost a no-brainer, but I want to know, like, suppose you have an early morning surgery or a night emergency call.
Yeah.
Which would you consider more stressful?
Of course, stressful is always the night ones, emergencies,
ones,
right?
Yeah. So
You don't want to get up in the middle of the night for anything. Yeah.
So how is it going now with that? Like, I mean, since you've gone into a more organized sector, I don't think you're dealing with too much of that.
Not
right?
too much anymore, because I have doctors who are helping me out with this. So they are on shifts 24 hours. So they will handle the emergencies. I just have to be there once everything is ready. So it becomes much more easier for me.
How many surgeries do you think you would do in a day, or probably in a month?
In a day, we do one major and two minors.
One major, two minor. Okay, that sounds good. Can you tell me more on the future of fertility medicine?
I think, as we already discussed, AI is the way forward.
That's the way forward.
Yeah,
okay.
I think AI is definitely going to take up a lot of, they're going to take up in a lot of fields of medicine. And fertility, we are already seeing it being used. So now they started using embryoscopy, which means basically they will see the embryo grow from a single cell to a 8-cell stage every day. So you can actually see the growth. Yeah, that is all. The technology is already there, the embryoscopy.
Okay.
Now using that technology, they're going to feed it to the AI, and the AI will tell which embryo out of all of this will have a good opportunity or a good chance to implant when you transfer it into the uterus.
Okay. Wow, that's amazing.
Yeah.
So I've also heard of, I mean, it's a concept which has been going on for a long time, but about this freezing the eggs.
Yes. Yeah.
And I want to know more on that. At the same time, who's the ideal candidate for such a procedure?
Very good question. Actually, it's not a concept. It is something which is being practiced for a long time. The only problem is in India, our culture does not allow it most of the time. Because
Why do you say so? Right?
Because they still feel it's a taboo. Before it was impossible. At least now women are opening up to such things, because they still feel, why? I still have time. I still have time. They don't realize that after 25 or 30 years of age, the amount of destruction of the eggs is much more faster than when she was 25 to 30. So imagine she loses a lot more eggs in this time frame. So ideally, it's always best to keep them stored so that she can use it later. Because especially for women who are going to do higher studies, they want to do their post-graduation, they want to, probably go up the, corporate ladder. You want to be able to save your eggs for your future.
So, ஒரு egg freezingங்கிறது வந்து ஒரு safe alternative, like for your future. You're able to safeguard your future, you're saying, for your reproductive.
இப்போ நீங்கள் பார்த்தீங்கன்னா, imagine someone like Jennifer Aniston.
Yeah.
She still today regrets that she did not freeze her eggs when she could.
Okay.
maybe if you tell her, she said, I did not know such an option even existed. So when you have the information with you, it's always better to take that.
இப்போ ஒரு காமன் கொஸ்டின் இருக்கும் எக் ஃப்ரீசிங்கில், லைக் சின்ஸ் இட்ஸ் நியூ, அவங்க பேஷண்ட் வருவாங்க, தென் they'll say சார் இதனால் எனக்கு வந்து ஏதாச்சும் பாதிப்பு இருக்கும், பாதிப்பு இருக்குமா, இல்லைன்னா என்ன ரிஸ்க் இருக்குது இந்த ப்ரொசீஜரில், புரியா? டெல் மீ அபவுட் தட்.
பிகாஸ் இது வந்து இட் ஹஸ் பீன் கோயிங் ஆன் ஃபார் ஸோ லாங், ரிஸ்க் ஃபேக்டர் பார்த்தீங்கன்னா ரொம்ப கம்மி. அனஸ்தீஷியா ரிஸ்க்ஸ்
ஓகே
ஆர் பேசிக்லி த வாட் வி ஆர் லுக்கிங் அட். இல்லைன்னா வந்து இந்த ப்ரொசீஜரை பார்த்தீங்கன்னா இட்ஸ் அ வெரி மைனர் ஐ மீன் இட்ஸ் அ வெரி மைனர் ப்ரொசீஜர். லேப்ரோஸ்கோபி கூட பண்ண மாட்டாங்க, த்ரூ அல்ட்ராசவுண்ட் ப்ரோப் வச்சுட்டு எல்லாமே எக்ஸு வெளியே எடுத்துடுவாங்க. ஸோ இட்ஸ் நாட் அ வெரி காம்ப்ளிகேட்டட் ப்ரொசீஜர்.
ஓகே. அப்போ
இஷ்யூஸ் ஆகிறதுக்கு unless you are very bad at what you do, I don't think you're landing in issues.
Okay.
Landing up in issues.
அப்புறம் ஸ்டோரேஜ், வாட் இஸ் how does that happen?
ஸோ இப்போ என்னென்னா, we take these eggs or embryos, இது வந்து நம்ம கோல்ட் ஸ்டோரேஜில் வைப்போம். These are small containers and these can be stored up to whatever time. Because இப்போ என்ன பண்ணாங்கன்னா, one lady had an embryo stored when like for 20 years.
20 years?
20 years. And had that same embryo transferred later. Of course not for herself, but someone in her family.
It's amazing.
It's amazing, right?
So in the awareness,
So that means she is the same age as the person, the embryo is the same age as the person who's getting transferred into.
It's amazing. I mean,
that's like science fiction, right?
Yeah, it really is.
Yeah.
So have you brought this awareness? உங்களுக்கு வந்து மக்களுக்கு தெரியுமா இந்த மாதிரி எக் ஃப்ரீசிங் ஒரு ப்ரொசீஜர் இருக்கு, ஃபியூச்சரை வந்து பாதுகாப்பு? ஸோ do they have that
awareness is less. ஏன்னா not many people talk about what you should do, what you can, what இப்போ நீங்கள் மேக்ஸிமம் பார்த்தீங்கன்னா இன்ஸ்டாகிராம் or ஆன்லைன் you see what people say, நீங்கள் இந்த லைஃப் ஸ்டைல் பண்ணுங்க, இல்லைன்னா இந்த எக்ஸசைஸ் பண்ணுங்க, இல்லைன்னா இந்த சப்ளிமெண்ட் சாப்பிடுங்க, இதை சொல்லுவாங்க. பட் no one talks about egg freezing. So this is our duty as medical practitioners. We have to bring the word out because no other person is going to do it because it's not in their interest. So I think as a public announcement, I think doctors have to do that part of
awareness
of spreading it to the public.
Sorry. Okay, let's say I mean a person who's not planning to have a child early, I mean for the time being because of certain personal reasons,
yes,
they can consider this egg freezing option. At the same time, maybe if they have not got married and certain other things, right, delayed marriage or something like that, I don't know what the personal reasons there are there.
Personal or professional also?
Professional. Okay.
Yeah.
Can you tell me besides that where you would suggest
egg freezing?
Yeah.
Cancer patients.
That's what
இப்போ வந்து அவங்களுக்கு we know கேன்சர் தெரப்பினால, கீமோதெரப்பினால they will lose their eggs for sure. அந்த சிச்சுவேஷனில் நம்ம வந்து we save the eggs so that later வந்து அவங்க they can use their own eggs to become pregnant.
ஒரு கேன்சர் பேஷண்ட் பார்த்தீங்கன்னா அவங்களுக்கு ஒரு சான்ஸ் இருக்குது,
of course,
to have a child.
of course.
That's big.
That is big, yes. இப்போ வந்து imagine இல்லைன்னா அது ட்ரீட்மெண்ட்க்கு அப்புறமா if they want to have a child, it will become impossible for most of them. Chemotherapy-nala, radiotherapy-nala.
Where this is missing is just the lack of awareness, I feel.
Lack of awareness. But I'm happy. Many இப்போ என்னன்னா நீங்கள் பார்த்தீங்கன்னா even the radiotherapists and cancer specialists,
they're telling,
they themselves will not guide the patient. ஏன்னா வந்து they are also very linear thinking. அவங்க கூட வந்து சரி உங்களுக்கு கேன்சர் இருக்கா, வாங்க கேன்சர் ட்ரீட் பண்ணலாம். But they will not look at the patient's fertility unless the patient asks them for it.
Okay.
But now it is becoming a little bit more common.
Nice.
For because we are also not only giving awareness to the public but also to the doctors, say what, these patients might want to become pregnant later, so give them this opportunity. So appo yes, they'll be like, yes, we will send them over if the patient wants and so on.
Got it. Have you ever come across a situation like this?
So many.
Okay.
So many patients who are having testicular cancers.
Okay.
Patients you can even freeze the sperm.
Oh, really?
Yeah, we can also freeze the sperm. So we either freeze the sperm or people who are having ovarian tumors, நம்ம வந்து freeze பண்ணிட்ட அப்புறமா they go in for surgery, remove the ovary and go for chemotherapy, and after like 2-3 after 1 or 2 years they'll come for the transfer.
Amazing.
Yeah.
What's next for you?
for me.
Yeah, what's next for you? Now you've come and you've almost, like, I'd not say almost, you pioneered today's version
Yeah.
of IVF,
Yeah.
and I knew when I told you about the 3D
Yeah.
laparoscopy, you
Yeah.
will venture into all the latest stuff,
Yeah.
and
Yeah.
you'll know which is going to work out also.
Yes.
I
Yes.
don't think you'll just take it because you
Yes.
feel it's a trend. You will
Yes.
only see
Yeah.
what will work out.
Absolutely.
So I'm sure you're thinking ahead. What's next for you?
It was a very good thing you brought up because I had an option. Whether should I go for 4K or I should go for 3D?
Yeah.
So this was the ultimate decision I had to make. I decided to go for 3D because I wanted to have an extra depth.
Right.
Because whenever you see a 3D movie, you see there are certain certain characters in front of you, certain characters behind you, right? That's the same thing what we see during surgery as well. It makes our surgery much more easier, faster, and more efficient.
Okay.
So the 4K now is nothing. The same resolution it has increased 4 times. So you can have a much bigger screen, but it's again, that's just more fancy. That's all.
That's it.
That's it.
So as of now, you're moving in the direction
3D,
with
yeah.
3D. Okay.
Yeah,
And
yeah.
what about robotics?
Yes, of course, robotics is the future. I have trained myself in it.
Okay.
But right now, when I can still do it laparoscopically, I don't need a robot. But there will be a time when, I might not be able to be as efficient as I am right now in my surgeries as you age, isn't it?
Yeah.
So what happens? The robo removes your tremors.
Oh, it removes the
Yeah.
tremors. Okay.
So if you have any tremors, you still have the knowledge in your brain. How do you translate it into the patient if you cannot work with your hands efficiently? The robot does it for you.
Okay. Got it.
So the robo in a way is like for it's the future anyway, and you slowly progress into becoming a robotic surgeon.
So is it difficult transitioning to?
Not at all.
It's not difficult.
It is the principles are the same. In fact, in robotic surgery, you don't have to change your clothes. You don't have to wash. You can sit in your chair like a king and you can do surgery.
Oh my God.
Yeah, the screen is in front of you. You have like two, joysticks. You keep rotating like that, and it does the
your
surgery.
favorite, yeah.
That's my favorite. Yeah, sitting in a chair and doing surgery. Of course, why not? Yeah,
Nice. Okay.
yeah,
So, could you tell me, there are some people, like, ஒரு சில பேஷண்ட்ஸ் பார்த்தீங்கன்னா, டாக்டர் ஐவிஎஃப்ல காஸ்டிங் ரொம்ப ஜாஸ்தியாக இருக்கும், and then they waste a bit of time doing other things, and then they come back and then they go back to IVF again.
yeah.
Now, with these cost implications and all of these things together, what is the right approach? Who ideally needs IVF? And when would you tell these people that no, you're wasting more money by wasting time? Like, how do you balance this for a patient?
I think it's all depending on the patient's age.
Okay.
That is the one factor which is going to determine what you have to do. Or if a lady comes at around 40 and she says, "Doctor, I need more time," I'll say, "You don't have time."
Got it.
Right? So you need to channelize it depending on the patient's age.
Okay. And now are they more accepting with these treatments? And because has it always been more about the cost, or it's the efficacy finally? What is the thing now?
Stopping people from going for treatment,
Yeah,
I think it's a taboo.
it's the
It's a
taboo.
taboo.
Okay.
Is the amount of medications she has to take,
Not medications. Okay.
and also it is the results, which is only around 35 to 40%.
Oh, okay.
40% chance only with the pregnancy with IVF worldwide. People are saying 90%, 100% are all just gimmicks. It's not that. Worldwide, the chance is only 35 to 40%.
Okay.
So, taking all of these variables inside, imagine it's like a gamble.
Oof.
You pay this much money and then you do not know whether you're going to become pregnant or not. That 40% gamble. So, that anxiety, what it builds up. All of these things together, people don't want to go in for IVF, and rightly so. I also don't force anyone for IVF. We always try all our options, see if in case you're able to conceive naturally. If it doesn't happen, then your last option will be going in for IVF.
That sounds good. Yeah, that's fair enough. In your fertility treatments, right? Could you tell me one of the most successful stories with any patient of yours?
Yeah.
Maybe the most difficult and the most successful one.
I can tell you one, which I still don't believe it has happened for us. We had a patient who came in from Bhubaneswar. She had 2 IVF failures, which means she has failed. Every time they try to get the eggs, they probably got 1 or 2 eggs. All of them were poor quality. So that's the reason why she was not able to become pregnant. So I said, me doing the same thing will not go. It's not going to change your results. Let us try something new. So I'm sure you would have known about stem cells, right?
Yeah.
So what we do is we have got. I got our friend Dinesh. I think his audio was on the
Yeah,
podcast
yeah.
before, to extract her stem cells.
Are you serious?
Yeah, from a bone marrow, and then we process the stem cells and we inject it into the ovary. And I said, you come after 3 months, I will do the same egg collection and try to make sure you get pregnant. Within 2 months, she called me and said she conceived naturally.
Oh my God.
So, like when things like this happen to you, you'll be like, okay, maybe there is something in these experimental therapies as
Therapies,
well.
yeah. So
There are things that we still don't have enough data to tell everybody go for stem cell. But we know that things like this can, help us in trying to probably get a study together or make a study to make sure that, see its efficacy and see how you can actually use stem cell for our benefit. So yeah, this was one of the cases which I found was very peculiar and, interesting.
so yeah, so there seems to be some truth in stem cells then.
Yes,
Yeah.
they use it for everything, isn't it? They use it for your
Joints, your hair,
joints.
everything.
So I thought, why not, you use it in the ovary? And there were like 1 or 2 papers written on it. So I thought, okay, let's try it out. And Dinesh was there, so I just called him and he got
It's
the stem
ridiculous.
cell. Yeah,
Amazing.
yeah.
You should have done a publication on
But
this.
it's only one person, no? So at least I need a data of 15 members to be able to do that.
Oh.
So far I've done it for 8, and out of them, 2 of them conceived naturally. So
Okay,
I'm still
naturally.
trying to get the complete data to give a full analysis of what to do. So yeah, I'm thinking of giving. I'm thinking of putting this paper out.
Excellent. So, what would the best, advice you could give to couples who are struggling with infertility?
Yeah,
Couples, because this is a lot of a psychological aspect also.
yeah,
See, you one end of the spectrum, your surgery is one thing. You have to conquer that, and that'll be good in your field. But it's also psychological.
Yeah.
You should be able to convert the patient successfully without them having problems between themselves.
yes.
That is something I felt. How do you
I think the only thing we can tell them is to have hope
Okay.
and believe in the treatment. These are only 2 things which can help them, because none of the other things are in their hands.
Yeah.
The hope is in their hands, belief in the doctor is in their hands. With these 2 things, they have to take it forward. Because, if you are thinking, what if this happens? I read this thing in Google, I saw this in Instagram, it is only going to confuse them more. It is only going to make them even more, I would say, anxiety driven.
I think that makes it worse also.
It makes it worse.
Yeah.
In fact, social media has been shown to be one of the most, highest reasons of why people are having anxiety nowadays. And of course, when you already have an issue, and you tend to see more of that, so try to avoid those things, especially when you are, undergoing fertility treatment.
Okay. Yeah, this is there's something I've been watching you do beyond all of that, and I used to see your posts and your status on your CSR activities.
Yes, yeah,
And I thought, I'm a big believer of all that.
Yeah,
You know, I've also done a few myself,
Yes,
and
yes.
I definitely encourage all our batchmates to do that.
Yeah,
That's something. Could you tell me more about how did that start though? Like, how did you start doing CSR activity? Like, what do you do in your hometown or wherever you're doing?
yeah.
When and in the camps எல்லாம் எவ்வளோ பண்ணிட்டு இருக்கீங்க, எவ்வளோ மக்களுக்கு பண்றீங்க, எப்போலாம் பண்றீங்க?
மாதத்துக்கு அட்லீஸ்ட் 2 கேம்ப்ஸ் நம்ம பண்ணுவோம். நம்ம வந்து சென்னை, நம்ம பெரிஃபரி அரௌண்ட் 2.5 hours ஃப்ரம் சென்னை.
ஓகே.
நம்ம போயிட்டு வி கண்டக்ட் ஃப்ரீ கேம்ப்ஸ். அவங்களுக்கு வந்து ட்ரீட்மெண்ட், லைக் ஃபியூ மெடிகேஷன்ஸ், ஃபியூ டெஸ்ட் ஃப்ரீயாக பண்ணிவிட்டு, அவங்களுக்கு கன்சல்டேஷன் ஃப்ரீயாக பண்ணிவிட்டு நம்ம வரோம். திஸ் இஸ் மோர் ஆஃப் அன் அவேர்னஸ். நான் சொன்ன மாதிரி ஒன்லி அபவுட் 1% ஆஃப் த ஹோல் இண்டியன் பாப்புலேஷன் இந்த மாதிரி ட்ரீட்மெண்ட்ஸ் இருக்குன்னு அவங்களுக்கு தெரியும். There's still a lot more number of people where education and awareness is important. So this is my part in trying to give awareness for the people. இப்போ அவங்க ட்ரீட்மெண்ட் கொடுத்துட்டு if they conceive, we are all happy. These people they will never be able to afford treatment. But the awareness is what we are looking at. So if they inform others, then the awareness is going to increase over there. So இந்த மாதிரி நமக்கு procedures இருக்குது, இந்த மாதிரி டாக்டர் சொல்லியிருக்காங்க, all that awareness needs to go to the common public.
So at least twice a month you're.
Yes.
Oh, it's excellent. And in the camps எத்தனை patients வருவாங்க உங்களுக்கு?
Around 60 to 70 patients.
That's good. That அப்போ you got some awareness then. Like
Yes, yes. So of course always there will be people who are just coming to waste your time. But at the end of the day, there will be at least, so out of all of this, 1 to 2% of patients come back to us in Chennai to get the treatment done, and the rest of them, they keep following up with us.
Got it.
Some of them become pregnant, and then they start having, because many people, நீங்க பார்த்தீங்கன்னா, not everyone requires treatment. Basics, not many people know that intercourse has to be in one particular way.
Okay.
So I'll tell you this very funny story. One guy, when I went to one of these places, he was thinking the babies are born from the belly, so they were having sexual intercourse using the belly button. So so I'm telling you, people are not aware of many things. This whole sexual issue is like one big thing all by itself.
Yeah.
And awareness, and so I would think that by giving this kind of information, people are more aware. Yeah.
Yeah, that's quite surprising that they have no idea.
It's just like that.
Education,
Right?
it's just
you just think that everybody knows everything. We just believe that everybody knows everything, but that is not true. Only after doing these camps, a lot of things came back to me. A lot of them have never even had sexual intercourse and saying, why I didn't have a baby. They said we are married, so we should have a baby. So I'm telling you, there's a lot of misinformation going on, especially in the rural areas.
Rural areas, okay.
Yeah.
So we still have a lot to cover over there.
Lot to cover.
A lot to cover, okay.
Yeah.
So would you feel that it would be helpful if some way in the future the cost gets subsidized for rural patients on fertility issues, I'm saying, right?
Yeah.
That would be something people should look into, right?
I think more than cost, I think there should be doctors, moving to these places and giving specialized care.
Okay.
That will be more beneficial if there is someone who's more accessible to them, rather than someone only coming once in a month and seeing them. If they have someone already accessible for them over there, it will be more beneficial. But that is going to take time.
Yeah. We could start with our own batch. We could start with our own.
But who will go and stay there?
Stay there, yeah. Stay is the thing.
That is the thing.
Yeah.
See, it's not an idea about going there once in a while.
Once in a month, okay.
It's about, someone dedicatedly staying
for
there,
that,
and for those people over there. Because they also have a lot of issues which, are not being addressed. It is in fact oversaturated in Chennai. Yeah. Like every street has at least 4 to 5 fertility centers.
It has become like that.
Yeah, like every street you go, you will have 4 to 5 fertility centers. The need is there, but still when you look at the rural areas, they have a lot more need.
That's true. We've not even thought about
We're not even, brushed the surface of that.
I've also, when I was talking about time management, right?
Yeah.
I think, this is what I heard, right? In gynecology and obstetrics or fertility, whatever. Compared to other surgeries, I think here, since it's a couple, it's a family, how do you manage the fact that people they'll want to spend a lot of time talking and asking doubts? I think it's a little more here, right?
Yeah.
It's a little more,
Yes.
in this field.
Yeah.
So how are you going to manage when you have a trunkload of patients and you're going to have to counsel them effectively? So what is your protocol?
So I usually have a counselor as well.
Oh, you have a counselor.
So they would take care of the the psychological parts of things, because that is not my focus. Because if I start focusing more on their psychological issues, right?
Yes.
My treatment thing will take a turn, right?
Yes.
So I think I have a psychological counselor as well. So she handles the psychological part of things to make sure the patients are calm, they understand what they're doing, whether they're having a good rapport with themselves amongst each other. This is very important. We don't look at it. My job is not to give you a baby. My job is to start, to make you start a family.
Yeah.
So for that, you all have to be together for that. So, and for that, we need a psychological counselor for sure. And in today's day and age, it's an absolute must.
So this is a good thing you've told, because நாளைக்கு வந்து யாராச்சும் ஹாஸ்பிட்டல் ஸ்டார்ட் பண்ணுறாங்க,
Yeah.
எல்லாமே நான் தான் செய்யணும்னு இருக்கக்கூடாது.
No.
ஒவ்வொரு டிபார்ட்மெண்ட் கவுன்சிலிங் and then you come to the doctor.
Yeah.
So that on the time வந்து you won't feel, the patient also won't feel, ஐயோ நான் டாக்டர் கிட்ட இது கேட்கணும்னு இருந்தேன், அது
Yeah.
கேட்கணும்னு இருந்தேன், that
Yeah.
question comes up.
Yes,
ஸோ
yes.
முன்னாடியே வந்து கேட்டு வச்சுட்டு அதுக்கப்புறம்
Yes.
இங்கே வந்தாங்கன்னா
They
5
will be
minutes of
satisfied.
consult. That's good.
They'll be satisfied.
That's a good idea.
Yeah. So right now it's a clean cut practice for me. So the patient sees the the RMO, that is the doctor first. Doctor means the one who takes a history, and then they go in for the investigations.
Okay.
And then they see me, and if I think they require any extra psychological counseling, then at that point of time I will route them to them.
Got it. The cost factor fertility treatmentல உங்களோட ஹாஸ்பிட்டல் வந்து எப்படி மேனேஜ் பண்ணுறீங்க? லைக் ஹவு டு யூ மேனேஜ் இன் த சென்ஸ் யூ ஹேவ் இட் லிட்டில் மோர் கன்சைஸ் ஐ ஃபீல்.
Yes.
ஹவு டு எப்படி வந்து மற்றவங்களுக்கு அக்சசபிளாக வைக்கிறீங்க அந்த இதுக்கு, அந்த காஸ்ட்டுக்கு?
I think especially in IVF, there's a lot of drama being played. Get one cycle, get 2 cycles. I mean 2 IVF cycles free, and all of these things. See, no hospital is going to give you a treatment for free of cost. I think it's always better to be more open with your patients. Tell them what exactly is the cost they're going to get into before they get into it. Because a lot of them, if you see, they get into the treatment thinking it's only going to be one particular amount. But then after they go, they say, in the add-on irukku, and the add-on
that is
irukku, freezing is more, this is more. So then by the end, they'll be paying a lot more than what they initially thought. So they won't be financially ready to go for it. So they'll get stuck halfway through. So then they start taking loans, and then they start. So this happens very commonly, unfortunately. So I think idea is to be very effective in communicating the finances, because of course I would say IVF is it's a rich man's disease. I mean, if in case only if you're able to afford it, can you take treatment? And again, it's a gamble. I told you 40% is only chance.
That's
what
very
we
honest
get.
what you're saying.
Yeah. So when that is the case like that, you'll have to be ready with your finances before you even seek treatment. In terms of trying to make it more accessible to everybody else, I think government has to take an initiative and say, this is the set price you can have.
Okay.
This will be your cost for IVF.
Okay.
And you cannot go beyond this. If they keep a rule like that, then it will be standardized all over the thing, and the patients can choose if they want to go to one center or another.
Understood. Okay, that makes sense.
Yeah.
ஸோ எனி பேஷண்ட் இப்போ உங்ககிட்ட வராங்கன்னா ஒரு பட்ஜெட்டோடு வந்திருப்பாங்க ஐவிஎஃப்க்கு, நீங்கள் என்ன சொல்லுவீங்கன்னா அதுக்கு கூட ஒரு 10% வச்சிங்கன்னா கரெக்ட், லைக் டு பி சேஃப், ரைட்? தட்ஸ் வாட் யூ வுட் சஜஸ்ட் ஆல்சோ.
Usually we give them straight up, tell them exactly what will be the cost, what they will incur.
Perfect.
I will not even tell them 10% more, 10% less. This is the cost, this is what it will be for you.
That's the best.
That is the best thing, because I don't want them to have any other burdens other than that. Isn't they are already in a big burden.
Yeah.
You want to make sure that, in fact, and the cycle should be positive. It will be positive. If in case they keep getting stressed throughout the time of the treatment, then obviously they will not have a good result also, because stress by itself is one of the major factors for infertility.
And the biggest trigger of stress is the finance.
Finance, of course.
So அதுவே ஒரு ஸ்ட்ரெஸ்.
So if they are already open and ready for it in the starting, till the end they will not have any of these stresses.
Good. That's good.
Yeah.
Yeah. About your dad.
Yeah.
I mean, how is uncle doing?
Yeah, he's good. He's good. He he wanted to say hi to you.
I'll come home sometime.
Yeah, please do, because I think we both. I think me and Suresh, we have a history, because we studied together in college. So I think we are preparing for exams at my place.
Same thing now.
Yeah. So so we both used to study at my place. So yeah, good times.
So how, I mean, two things about your father. He's a legend himself in this field.
Yeah.
And how do you envision yourself carrying forward his legacy?
Yeah.
And what inspired you from him? You would have grasped something from his work.
Yeah.
And you would have got inspired to, unless you're inspired, you'll not get into it. I know that about
absolutely,
you.
yeah.
And what would be the valuable lesson he has taught you?
I think patience is something what he taught. Nothing comes fast, nothing comes free. I think that is something which we need to really learn, because we all feel we are just finished, we know everything, we should get the best, you should become famous fast. Everything takes its own its own time.
Okay.
And we need to be patient. That's what I learned from him. And I think it's really helped me a lot.
It's amazing. And he's also very humble. Like the same roots have come through.
Yeah.
So that's good. So I'm going to go into a rapid fire round with you.
Sure.
Okay.
Okay.
Okay. IVF or natural conception?
Natural conception always.
Egg freezing or embryo freezing?
Embryo freezing is better.
Reason?
Because egg freezing, used to have, every time you freeze a couple of eggs,
Okay.
when you unfreeze them or thawing process, you lose some eggs. The chance of you to lose embryos are much lesser.
Got it.
Yeah. Because, believe it or not, the embryo is considered as a single cell. The ovary is not considered as a single cell. It's a multi-cell. Yeah.
One word to describe your journey in reproductive medicine. One word.
Challenging.
If you weren't a fertility specialist, what would you be?
Tech influencer. Yeah.
One piece of advice you give your patients.
Yeah. Stay hopeful.
Most common misconception about IVF.
That not everyone requires IVF.
Yeah. What's the one thing people don't know about you?
One thing people don't know about me, I'm a left-handed guy.
That's a good one.
Yeah.
Delivering a baby or delivering TEDx talk?
Obviously, baby. Nothing gets more exciting than that.
Doctor, I'm pregnant or doctor, I'm positive?
Positive for what?
Same thing.
Pregnancy. It's the same thing, doesn't it?
Same question. Got you rapid fire on that.
Yeah.
Midnight emergency call or early morning surgery? We already spoke about it.
Yeah, I think it's obviously
the
early
answer.
morning surgery. Yeah.
Surgical precision or social media precision?
I think obviously surgical.
No brainer.
You can be wrong on social media. You're wrong in surgery, Yeah, you're screwed. Yeah.
The most heartwarming moment you've had in your, I'd say, whole career.
I think that the story which I shared with you, right? The patient who had a cervical incompetence, and after which I did the procedure and she had a pregnancy and she
pretty
named
amazing
the
story.
baby after me. I think that's probably I think that's the best feeling ever. I had, Yeah.
Was it a boy or a girl?
I was a boy.
Okay.
My name.
Yeah, yes. I remember now.
Yeah.
Okay. One thing your patients say that always make you smile.
They say doctor, I see you. I'm confident that it's gonna work out for me. So I'm very happy about that.
Yeah, I think that.
I think that you give hope.
Yeah.
You give hope, whether you believe it or not. You give them hope, and even if they have that 5 to 6% hope that they get conceived, that is more than enough. Many of them get pregnant that way. So
Perfect.
hope is most important.
The most awkward or funny question any patient has asked you.
Most awkward
Or funny question any
funny
patient.
question.
Yeah.
I think half the things what we deal with are all awkward and funny, right? So I think the most funny question would probably be can we have a or probably one of the most common ones people say, we are happy with each other without being sexually active. Can we have a baby?
Oh.
Yeah, it's I would say awkward, but socially it's awkward. But nowadays when I look at it, it's okay because there are ways and technologies we can use that they can actually get pregnant without actually having sexual intercourse.
Okay.
So it is fine.
Oh, they have asked questions like
Oh
that.
yeah, absolutely. There are a lot of these modern couples who come to us. They're like, I believe they are asexual. They identify themselves as asexual.
Okay.
So they're like, no doctor, we don't want to have sex, but we want to have kids. Let us know how. I won't say it's awkward in today's world, but if you look at it in a social construct, it is definitely awkward.
I thought the funny one would be where the belly button question.
Oh no, those are fine. Okay. That's just that you're not yet aware of the situation, right? Yeah.
Your dad, in one word.
Inspirational.
A message to somebody who's dreaming to become a fertility doctor.
And fertility doctor, I would say don't do it. Don't do it. It's not worth your time and effort, because by the time they become fertility experts, the uh, the competition is going to be so high. It will be very challenging for them to set themselves apart, because wherever you go, you're going to be able to give the same results.
Okay.
Whether you are in my hospital, whether in another hospital, your results are going to be the same. It's the same 35 to 40%.
Okay.
Now, how are you going to differentiate yourself? That is going to be an upward struggle. For me, as I told you, there are a lot of things which I did, which with luck involved, I was able to come to this point. So, it for somebody else to be able to do this at the same time frame, it will be very challenging.
Understood.
Yeah, so I would say don't go in for fertility. There are so many new fields coming up.
Okay,
I
like?
would, as I told you, like the cosmetic gynecology is something they
I was
can
about
look
to ask you
into.
about that.
Yeah, cosmetic gynecology is something they can do. They can start specializing in robotic surgery. Endometriosis is going to become a big thing in the future.
It
So
is.
it is already a big thing. It's also a lot of patients are suffering from endometriosis. So endometriosis care is going to be. So a lot more they can do to use their skill efficiently rather than just doing fertility.
Okay, that's very honest advice. That's good.
Yes, honest. Yeah.
Perfect.
Yeah.
So I also know that you're into aesthetic gynecology
Yeah,
also, right?
cosmetic gynae.
And cosmetic, sorry, cosmetic gynecology. So now, how long have you been into that? Like, what made you get into it, the field?
Close to 5 years now, 5 to 6 years, I
5 to
was in
6 years.
cosmetic
Okay.
gynecology. The reason why I got into it is quite surprising, because one day one patient called me and said, "Doctor, do you do LVB?" So obviously, when you think of LVB, I was like, my mind went into all different directions. Like something to do with the heart, something to do with the brain, something. Then I said, no, I don't know what you're talking about. What is LVB? I asked her. Obviously, you feel bad, but I
Yeah,
had
you
to
have to
ask
do it.
her.
You have to. Yeah.
I said, what is LVB? Laser vaginal bleaching. I said, I never heard of this, what is LVB? So then she said, no, doctor, laser vaginal bleaching. This is the new thing, how come you don't know about it? So then I found out there was something called as cosmetic gynecology after that, where they're using lasers, they're using RFs to tighten the vagina, to do a lot of other things, like for people who are having menopausal symptoms, to give better lubrications, because a lot of issues women have, like whenever they cough or sneeze, they have dribbling of urine.
That's
So to
right,
solve those issues, so there's like a whole new world of things which was open to me after that one question what she gave. So I was very thankful for that patient. I said, you know what, I'll go get myself trained and come back.
Okay.
So I went to Europe, I went to UK. I got trained there, came back here, got trained here again. So yeah, it's been
So
5-6 years.
Europe and UK is, I mean, sorry, the European nations is where
It's
they're-
huge over there.
Oh, okay.
It's huge. People spend millions of dollars in the US and UK. In India, still it's a much smaller fraction of people who are actually going, because once they become old, right? They think it's okay, it's a part of life. They just leave it. Even if they're having dribbling of urine, or even if they don't talk to it to their doctors, neither do the doctors ask them. So all of these things are now slowly changing, though. People are more on social media, people are aware this is not normal. Having urination while you're working out, or when you're just coughing, is not normal.
Yeah.
So people are thinking of that, and they're going in for treatments now. So I think next 4 to 5 years definitely is going to be on an upward scale. So people who are looking for doing something in gynecology, this will be a good way to go into it.
Right.
Yeah.
And regarding fitness, I have a few questions.
You have questions?
Yeah, I have questions in your field.
Okay,
In your
okay,
field.
okay.
So now when it comes to fertility, right?
Yeah.
And you say they should exercise regularly, they should have a good diet and all that, along with treatment, right?
Yeah.
But there are some people who overexert.
Yeah, I know. Yeah.
Suppose, let's say for combat sports or something like that.
Yeah.
Now, suppose the couple is trying to conceive. Do you think that overexertion could be a problem
Yeah.
for this thing, or it should be balanced, or you are not worried about that?
It is detrimental for
It's
women.
detrimental. Okay.
For
Because of
women
cortisol.
especially.
Okay.
Yeah, because of not only cortisol, also because of the low body weight, right?
Okay.
Women require a certain amount of body weight to be having a regular menstrual cycle.
Got it.
So they go into amenorrhea, state of amenorrhea, where they don't have menstruation, they don't have ovulation, and they have all other metabolic issues which come in later because of that.
Oh, okay.
You'll be surprised to know that even though all of these women are so fit, they still have PCOD.
Right.
So, what I would think is, yes, overexerting is definitely not good for women, even for men. If you look at it, like to one particular level is good, but beyond one level, I would not recommend
Not
it.
recommended. Okay.
Yeah,
Fine.
yeah.
And இப்போ இந்த சில வீடியோஸ் எல்லாம் பார்த்துருப்பேன் லைக் ப்ரெக்னென்ட் லேடிஸ் ரைட் லிஃப்டிங் வெயிட்ஸ் ஐ மை செல்ஃப் கெட் ஸ்கேட் சீயிங்
Yeah,
தட் ரைட்
yeah, yeah.
இப்போ நீங்க வாட்ஸ் யுவர் டேக் ஆன் தட் நீங்க என்ன
My
லிமிட் லைக் இந்த இத்தனை மாசத்துக்கு அப்புறம் வெயிட்
Don't do it.
டோன்ட் டு
See, what many women fail to understand is once they're pregnant, our center of gravity change ஆயிடும். So previously they were able to lift the weights in one particular way. Now they can't lift it the same way because they have an abdomen. The center of gravity is changed and they have a lot more chance of getting injured because of doing these things.
Understood.
So the problem is not lifting the weight.
Okay.
Problem is getting injured while you're trying to do something different because your body, you are not used to your new body. That is why. You might be used to working out, but without a big belly. Right? Yeah. Now with a big belly, it's more challenging. How would you take out the weights? How would you put back the weights? How would you do your crunches? All the machines are not made for pregnant women.
Agreed.
Yeah.
Okay. So how long would you say they could be going for their work or when to tone it down?
If it is non-complicated pregnancy, up to 22 to 25 weeks is okay.
For a complicated pregnancy,
Don't go to the gym.
don't even go, right? Yeah.
Don't even try.
Okay. Perfect. Thank you.
Thank you so much.
It was amazing catching up with you.
Yeah,
And
yeah, absolutely.
I think we covered some really good topics today.
Yeah, absolutely. It was great talking
We
to
are
you.
going to meet again
We should for the round table.
with the round table.
Yeah, yeah.